And there's perhaps no more stressful a situation than when you're confronted with a medical decision to make. And at some point, all of us are going to be in that position where we have to make a very important decision about the future of our medical care or that of a loved one to help them with the decision. And so I want to talk about that. And I'm going to talk about a very particular medical condition, but this stands as a proxy for all kinds of medical decision-making, and indeed for financial decision-making and social decision-making, any kind of decision you have to make that would benefit from a rational assessment of the facts. So, suppose you go to your doctor and the doctor says, I just got your lab work back, your cholesterol's a little high. Now, you all know that high cholesterol is associated with an increased risk of cardiovascular disease, heart attack, stroke, and so you're thinking having high cholesterol isn't the best thing, and so the doctor says, you know, I'd like to give you a drug that'll help you lower your cholesterol, a statin. And you've probably heard of statins. You know that they're among the most widely prescribed drugs in the world today. You probably even know people who take them. And so you're thinking, yeah, give me the statin. But there's a question you should ask at this point, a statistic you should ask for that most doctors don't like talking about, and pharmaceutical companies like talking about even less. It's for the number needed to treat. Now, what is this, the NNT? It's the number of people that need to take a drug or undergo a surgery or any medical procedure before one person is helped. And you're thinking, what kind of crazy statistic is that? Why, the number should be 1. My doctor wouldn't prescribe something to me if it's not going to help. But actually, medical practice doesn't work that way. And it's not the doctor's fault. If anybody's fault, it's the fault of scientists like me. We haven't figured out the underlying mechanisms well enough. But GlaxoSmithKline estimates that 90% of the drugs work in only 30 to 50% of the people. So the number needed to treat for the most widely prescribed statin, what do you suppose it is? How many people have to take it before one person's helped? 300. This is according to research by research practitioners Jerome Groopman and Pamela Hartzband, independently confirmed by Bloomberg.com. I ran through the numbers myself. 300 people have to take the drug for a year before one heart attack, stroke, or other adverse event is prevented. Now, you're probably thinking, well, okay, 1 in 300 chance of lowering my cholesterol. Why not, doc? Give me the prescription anyway. But you should ask at this point for another statistic, and that is, tell me about the side effects, right? So for this particular drug, the side effects occur in 5% of the patients. And they include terrible things, debilitating muscle and joint pain, gastrointestinal distress. But now you're thinking, well, 5%, not very likely it's going to happen to me. I'll still take the drug. But wait a minute. Remember, under stress, we're not thinking clearly. So think about how you're going to work through this ahead of time so you don't have to manufacture the chain of reasoning on the spot. 300 people take the drug, right? One person's helped. 5% of those 300 have side effects. That's 15 people. You're 15 times more likely to be harmed by the drug than you are to be helped by the drug. Now, I'm not saying whether you should take the statin or not. I'm just saying you should have this conversation with your doctor. Medical ethics requires it. It's part of the principle of informed consent. You have the right to have access to this kind of information to begin the conversation about whether you want to take the risks or not. Now, you might be thinking I've pulled this number out of the air for shock value. But in fact, it's rather typical, this number needed to treat. For the most widely performed surgery on men over the age of 50, removal of the prostate for cancer, the number needed to treat is 49. That's right, 49 surgeries are done for every one person who's helped. And the side effects in that case occur in 50% of the patients. They include impotence, erectile dysfunction, urinary incontinence, rectal tearing, fecal incontinence, and if you're lucky, and you're one of the 50% who has these, they'll only last for a year or two. So, the idea of the premortem is to think ahead of time to the questions that you might be able to ask that will push the conversation forward. You don't want to have to manufacture all of this on the spot. And you also want to think about things like quality of life, because you have a